Ahmad Masri, Mike Gibson, and we're talking about the outpatient hospitalization of patients with amyloid cardiomyopathy and the results from the Attribute trial. Ahmad, talk to us a little bit about what you did and what you found.
Yes, hi Mike. So glad to be here with you today. So in Attribute CM, just a reminder to our listeners, it's acoramidis versus placebo in patients with transthyretin amyloid cardiomyopathy. And as we are identifying these patients earlier and earlier, these other endpoints related to heart failure become more important. And in this analysis, what was looked at is outpatient worsening of heart failure, given that many patients, and especially the trial was conducted also during COVID pandemic, many patients don't really get admitted. They just have consistent increase on the requirement for their diuretics. And when you look at the study, 600 something patients were included, and the proportion of patients who met that endpoint were about 60% of those on placebo versus 40% on those on acoramidis. So pretty sizable, effect size and difference there in the outpatient worsening of heart failure. Also, when you look at the relationship between having an event that is outpatient worsening of heart failure and then subsequent events related to heart failure and mortality, you see a much higher hazard ratio and risk in terms of these patients who get that endpoint versus those who don't.
So, Ahmed, how many people would benefit from this? I mean, what was the absolute event rates? What was the absolute event reduction? And then what was the number needed to treat to prevent a hospitalization?
Yeah, that's a great question. So in the double-blinded period, you had about 40% of those patients on acoramidis having achieved that endpoint of outpatient worsening of heart failure compared to 60% on placebo. And so that's an absolute difference of 20% between the two groups, which translates into 1 out of 5 patients, so a number needed to treat as you alluded to. So it's pretty sizable difference, and especially knowing that this outpatient worsening does relate to downstream hard outcomes in these patients.
It does, and it's also very costly. Well, Ahmed, thanks for sharing with that today, and thanks to all of you for joining us.